the second part of the cranial nerves. The first nerve in the second group is the facial nerve. As usual, we have to start by the functions and the deep origin. The facial nerve, as you can see, the functions are all visceral functions. Special visceral efferent, motor to the muscles of the second pharyngeal arch, developing from the second arch, muscles of facial expression, muscles of the face and scalp, general visceral efferent, the parasympathetic fibers of the facial nerve, which will supply all the glands in the head and neck except the parotid. Special visceral afferent fibers, the taste fibers, and general visceral afferent fibers. These are the four functions of the facial nerve. The deep origin, the nuclei of origin, the motor nucleus of the facial for the special visceral efferent, superior salivary or salivatory nucleus for the general visceral efferent, nucleus solitarius for the post-afferent groups. The fibers of the facial nerve have an intra-substance course within substance of the bones. The fibers will curve around the nucleus of the abduction to come out on the surface of the pontomedullary angle, raising what we call it the facial colliculus, which is the abduced nucleus, as we have seen with the fibers of the facial curving around it. The superficial origin of the facial is from the pontomedullary angle above the inferior cerebellar peduncle together with the eighth nerve, the vestibulocochlear. That is the superficial origin. As it comes out from the pontomedullary angle, it has to pierce the pia, the arachnoid and the dura to enter the internal acoustic meatus. In the internal acoustic meatus, as you can see here, it is divided into two parts: an upper part, what we call it superior part, and lower part by the transverse crest. In the upper part, there is the facial area for the facial nerve. There is two vestibular areas here, superior and inferior vestibular areas, and area for the cochlear area. That's how it looks like, the internal meatus, which give passage for both the facial and the vestibulocochlear nerve. So as we said, the functions are all visceral, special visceral afferent, general visceral afferent, special visceral efferent and general visceral efferent. Deep origin, the nucleus solitarius, the motor nucleus of facial, the superior salivatory nucleus, the internal course, which are the intra-substance course, as we said. The motor fibers pass dorsally and medially, forming a loop around the abducent nucleus, as we said, in the floor of the fourth ventricle, forming what we call it the facial colliculus. Superficial origin, as we said, from the pontomedullary angle above the inferior cerebellar peduncle. That is a very good diagram here, where this internal meatus passing laterally above the inner ear, then it will sharply curve backward, forming the geniculate ganglion, then downwards through the stylomastoid canal to leave through the stylomastoid foramen to outside. Within the canal, as you can see, it will give the great petrosal, the chorda tympani, and nervus stapedius branches within the intrapitreous part of the nerve. That's a bony specimen with a cross section here, showing the course of the nerve in blue here. That's where it comes from, the above the vestibule, from the acoustic meatus, then the backward and the downwards. That is the middle ear cavity, the tympanic cavity here. And this is the mastoid process. The extracranial course of the facial nerve, when it comes out from the stylomastoid foramen, it will run forwards around the cartilaginous part of the external acoustic meatus to enter the substance of the parotid gland, where it crosses the styloid process, the retromandibular and the external carotid artery. Then it divides behind the neck of the mandible into its terminal branches, which come out from the anteromedial surface of the gland. That is the extracranial course of the facial nerve. Within its intrapitreous part, as we said, the great petrosal nerve, parasympathetic branch going to the trigopalatine ganglion, branch to the stapedius muscle, the chorda tympani, which will go through the tympanic cavity out to join the lingual nerve. Then, as it comes out from the stylomastoid foramen, behind the ear it will give the auricularis superior and inferior and the occipitalis muscle, then give the stylohyoid muscle and the posterior digastric to enter the substance of the parotid, where it terminates by the 5 branches: the temporal, the zygomatic, the buccal, the mandibular, and the cervical. That is the summary of the branches. So, as we said, within the canal, the nerve stapedius supply that muscle, stapedius muscle. The great or the greater petrosal nerve, which come from the genicular ganglion, contains parasympathetic fibers to the trigopalatine ganglion and few taste fibers to the mucous membrane of the palate. It reaches the cranial cavity through the hiatus on the anterior surface of the vitreous part of the temporal bone through what we call it the greater canaliculus to enter the foramen lacerum. There it will join the deep petrosal nerve, which is sympathetic nerve, coming from the sympathetic plexus of internal carotid artery. Both of them will form the nerve pterygoid canal or the Vidian nerve, which will pass through the pterygoid canal to the trigopalatine fossa to terminate by relying in the trigopalatine ganglia. That is the course of the great petrosal or greater petrosal nerve. The other large branch within the vitreous part of the temporal bone is the chorda tympani. It arises from the facial nerve about 6 millimeters above the stylomastoid foramen within the stylomastoid canal, then runs upward to perforate the posterior bony canal of the tympanic cavity, passing through the posterior canaliculus, pass forwards on the medial surface of the tympanic membrane between the fibrous and the mucous layers crossing the handle of the malleus. Then it comes out of the tympanic membrane, of the tympanic cavity, through the petrotympanic fissure to the infratemporal fossa, where it joins the lingual nerve. Through the lingual nerve, it will supply both the submandibular and sublingual salivary glands by secretory motor fibers, and carry test fibers from the anterior two-thirds of the tongue. That is the chorda tympani. At the exit from the stylomastoid foramen, behind the ear, it gives the posterior auricular nerve, which supplies the auricularis posterior, superior and inferior, and the occipital belly of the occipitofrontalis muscle. Then it will give a digastric branch to the posterior belly of digastric muscle, then a stylohyoid branch to the stylohyoid muscle, ending in the temporal, the zygomatic, the buccal, the mandibular, and the cervical branches, which supply all the muscles of the face plus the platysma in the neck. That is the branches in the face. As it comes out from the stylomastoid foramen, it contains only special visceral efferent fibers, only. The other three functions have been distributed through the three nerves, the chorda tympani mainly, and the greater superficial petrosal. Here is the temporal, the zygomatic, the buccal, the mandibular, and the cervical branches. That's an illustration which shows the temporal to the temple, the zygomatic on the zygomatic bone, buccal on the buccinator to the mouse, mandibular on the mandible, cervical to the neck. Facial nerve. Within the canal, as we said, that is the deep petrosal, that is the greater petrosal, joining the deep petrosal to form the nerve pterygoid canal, to terminate in the trigopalatine ganglion, where it will give secretory motor fibers to all the nasal glands, the lacrimal glands, the palatine glands, and the pharyngeal glands. That is the nerve to stapedius, the chorda tympani, the largest nerve within the tympanic cavity, very close to the tympanic membrane, as we said. It will join the lingual nerve as it goes from the petrotympanic fissure. Through the lingual nerve, it will give the sublingual, the submandibular gland, and carry fibers, taste fibers from the anterior two-thirds of the tongue. Behind the auricle, it will give the posterior auricular nerve, which will supply auricularis superior, inferior, and occipitalis muscle. Then branches to the stylohyoid, posterior of the gastric, and the terminal branches. That is the effect of injury of the facial nerve. That's how it looks like the face in case of injury of the facial nerve. The face, the mouse, will be deviated to the healthy side. The orbicularis oculi muscle will be paralyzed, so the opening of the eye will be all the time. The same thing on this side here is deviated to the left side. The orbit is opened here compared to the other side. The muscle squeeze can be seen here, but it cannot be done on the right side. That is the main feature or features here. But there is many features for the nerve paralysis. The patient cannot blow, cannot whistle, and there will be dribbling of saliva on the affected side. The deviation of the mouth is the very clear sign, and the non-closure of the orbit again is very clear. Loss of taste on the anterior third of the tongue will be there, of course. All the function of the facial nerve will be affected. But there is an important point on the types of facial nerve paralysis. There is an upper motor neuron lesion and lower motor neuron lesion. The difference between both of them is due to the crossing of the fibers from the motor nucleus of the facial from one side to another. So in the upper motor neuron lesion, the muscles around the eye will not be affected because one side will be supplying the affected side. But in the lower motor neuron lesion, the eye muscles will be affected. So testing the closure of the eye will differentiate between the upper motor and the lower motor neuron lesion. In the upper motor, the eye is normal according to the muscle function. In the lower motor, the eye cannot be closed.